Everyone should cancel their health insurance today, and here's why. Number one, it's a racket. Number two, I have paid cash for my any services that I've needed, and it's actually cheaper when you pay cash. Insurance is such a racket that if we all canceled it, they would have to do something about it. They would have to change it because they operate on our fear of getting sick, our fear of something catastrophic happening. You know
Hmm.
what? If you racked up $100,000 bill, you pay them whatever you can per month for the rest of your life, if that's what it takes. But this fear and paying, my friend said she pays $18,000 a year in insurance. I said, what if you put that into a high yield savings account and then if you ever need something, you have the cash to pay for it. I'm just saying, if we all canceled, they'd have to do something about it.
Now that's a crazy idea. It's not too bad. Not too bad. And especially when insurance companies are very trifling about what they want to cover when it's time to actually cover it. Now, it all depends on your risk management, to be honest with you. If you rather be more risky and say, you know what, if something does happen, I will have to be in enormous amounts of debt in order to pay this off, then I will. Versus paying for something and you are healthy unless something happens. A lot of money is poured into it. A lot of money is wasted, but you're paying for coverage. It's like getting an iPhone. It's like you're paying for Apple Care. And it's like nothing happened to my phone. I'm still paying for it. It's like $15 a month. Okay. Until my phone cracks. I've been paying this thing for 2 years. $15 for 1 year for 12. Let me just do the math. If you're paying $15, right, on your phone for Apple Care, $15 times 12 months is $180. That means you're paying $360 every 2 years, and your phone hasn't cracked until like the fifth year. Well, by that time, you would have paid how much? $900. You basically pay for a new phone, right? And when you get that screen replacement, it costs you $900 plus $20 or whatever they want to charge you, right? But you're paying because you want to have a peace of mind. That's it. That's all it is. And she's right. They do feed on your fear. Emotions. But we also see people make emotional financial decisions that they don't have to make, and they get an enormous amounts of debt, like getting a house, getting a fancy car, spending on credit cards. People do this all around. It doesn't have to necessarily mean insurance, right? So let me know your thoughts on this in the comment section down below. If you like this type of content, make sure you subscribe.
We are 5 weeks out from open enrollment, the day when we can all sign up for our health insurance. I took a closer look over the last week and realized that sky high prices continue. I have a family of four, and I'm paying over $25,000 a year solely on health insurance premiums, over $2,000 a month, and my deductible
Mm.
is still $7,500, which means my insurance doesn't really kick in until I spend $7,500 on medical costs that are actually in network. I'm at the point, honestly, where I'm thinking about foregoing health insurance entirely, which sounds like a pretty crazy and scary concept, but here we are. And how did we get here? Well, full disclosure, I used to work for a major Fortune 20 health insurance company for over half a decade. Know a thing or two about how we got here. I spent some time working on legislation, regulation, and legal issues, and I'll break it down for you. So, before the Affordable Care Act, aka Obamacare, insurance companies were actually able to deny people insurance if they had complex medical conditions and
Mm.
or pre-existing conditions, commonly termed. And then after Obamacare passed, insurance companies could no longer deny anyone who wanted insurance. And they also were further restricted on what they were allowed to price the insurance based off. Think of risk factors. So now, on a go forward basis, health insurers can only adjust your premium based on age, tobacco use, and location. So as a result, more people than ever now have health insurance, which is obviously a good thing, but the prices have skyrocketed as insurers are on the hook for
Mm-hmm.
ever increasing medical procedures, hospital costs through the roof, drug prices are exorbitant and continue to increase, and the American population is generally morbidly sick and obese. Um, yeah, so here we are. Honestly, thinking long and hard about whether I just forego insurance entirely this year. Would love to have an extra 2,500 in my pocket a month to pay for food, eggs, which feel like they're $100 a carton now, and would love to hear what everyone else thinks. I'll share a story. I went to the ER last year actually because I passed out, fainted, couldn't walk, and my ER visit was actually more expensive because I had insurance than if I just paid cash. And then the ambulance ride was denied as, quote, not medically necessary by my health insurer. On top of this, I have 2 kids with pretty complex medical conditions. Most of the specialists they see are out of network, meaning they don't contract with insurance. And when I do submit a claim, my insurer denies it or pays pennies for the amounts owed. I'm not really sure where this goes from here, but I think it's fairly certain that health insurance prices will continue to increase.
I just want to ask you real quick. Do you think insurance is a scam? His situation is very much different. He worked for an insurance company. He has kids that have a medical problem. He himself went to the ER. It ended up being more because he had insurance. Like, it can help, but it can also suck. And you're still paying. And if anything crazy were to happen, he said his deductible is $7,500 and he's paying $2,500 a month. Would you be willing to risk canceling your health care insurance? I personally wouldn't. And it's because I know I can always make an abundance of money. The healthcare insurance, sure, it'll go up. You know what I'm saying? But what's also going to happen for me is I'm always focused on making more money. You know what I'm saying? Every single year, I'm focused on making more money, making more money, making more money, making more money. What can you do? You know what I'm saying? I'm not finna risk, you know what I'm saying, being in extreme amounts of debt. Even if the insurance company is being trifling and they don't want to cover this, that, and the third. Listen, man, just make more money. That should be a motto we got going on this channel. Just make more money. You know, Nike, just do it. Just make more money. You know what I'm saying? People gonna be pissed about me saying this. I don't care. Well, Jay, not everybody can make as much money because they have undesirable situations. Just make more money. You know what I'm saying? Everybody can find something they can do to make more money. You got to be in a different vehicle than what you're in right now, and do them both at the same time. But I'm not canceling my health insurance just because I can save an extra $2,500 a month, and I'm pretty sure his family is under that. You know what I'm saying? Under that policy too. Like, I would hate to see someone not be able to take care of their kid because they don't have insurance. Call it a scam, call it whatever you want, but I call it insurance because it gives me a peace of mind, at least a little bit, in saying, you know what, if something does happen, you know, we got insurance. Versus I'm saving more money, but I'm being way more risky. You don't know what could happen, man. You don't know what can happen at what day and age. I'm good on all that. I put my risk management in my stocks, not with health insurance. Subscribe if you like the content. Let me know your thoughts on this in the comment section down below.
Okay, so open enrollment is coming up, and we're clearly very qualified to be talking about this.
I am. I'm a genius.
We're trying to figure out if we want to cancel our insurance and pay out of pocket or keep insurance. Bottom line is we're canceling insurance. How much are we paying per month for insurance?
For me and Beckham, it's about $550 a month.
Okay, so we've done all of our research, and Tyler's going to share it with you.
Oh, yeah, me. Just for like a typical blood panel that I have to do every year for insurance through work is $280. Like a women's hormonal test, that would be $289. With insurance, it cost me $190 go in to do an EKG, which took a minute. I could have just done an echocardiogram for $280. The comprehensive panel.
They have sales!
$308 typically, $281 on sale.
Okay, so if it's just like a random Tuesday and you feel like you're kind of getting the flu or something, you can go to Amazon One Medical is $50, Texas Health Breeze is $50, or $205 if you go in office. If you go in office to Texas Health Breeze, they can do x-rays and COVID testing, things like that, just a little bit more
Amazon had a service
versus
like
your
that.
telehealth medicine. Call on doc, same thing, $30 a visit, or you can pay $45 quarterly, and then it's only $15 every time you need to call them. For children, Blueberry Pediatrics is $30 a month, or it's $216 a year plus a one-time fee for the kit, but I have a code for that if you need it. Both of those are 24/7. We've had Blueberry since Beckham was born, and it's been a lifesaver. I will have that for the rest of my life, as long as I possibly can keep him on.
So you're not canceling
it. We also found JPS Health. I don't know if that's only a Texas thing or not, but if you make 400% or less of the FPL, the federal poverty level, you qualify for a discount. I think it was like 40% off of your medical bills. I mean, we're not people that get sick very often. Even if I am sick, I'm not going to the doctor unless I'm on my deathbed. So
yeah, let me just say this. I didn't recognize how valuable it was to like just take care of your health until like I started paying for my own healthcare insurance, and my mom would be like, "Oh, you're sick. Like you probably got a cold or something." I'd be like, "I want to go to the doctor." You know what I'm saying? When I was younger, and she was like, "Nah, you can wait it out a little bit. You know what I'm saying? Eat some soup, drink some water, drink some water, have some medicine. Man, it costs to be unhealthy. I'm good. It's gonna cost to eat healthier, but it's also gonna cost to be unhealthy. I'm good. Screw McDonald's, screw the unhealthy foods, screw eating candy and just eating whatever you want. It ain't the time for that, man. I'd rather pay more money up front to have healthier food. I don't care about the price of damn eggs. Okay. You hear people on almost every other video talk about the price of eggs. Like, bro, you don't have to eat eggs. But if you like eggs, get your eggs. You know what I'm saying? Listen, I'm gonna eat healthier before I pay more just for being unhealthy because food is cheaper. And if you're wondering, well, what about the people who don't have as much money? Again, the motto, make more money so you can eat healthier. It costs to be unhealthy, man. It's sad out here, but it's the truth. They make food unhealthy for a reason. That brings to my attention also the switch that happened to EBT at the beginning of this year. No junk food, no chips, soda, and whatnot, right? And there's a ton of people who are pissed off about EBT not being eligible to get junk food, right? But it's gonna cost you in the long run. Junk food, really? You want to fight for your right for junk food? Oh, but everybody deserves the. Listen, let's lose the entitlement mindset, okay? If you work and you get paid, you should get what you want. If we have to use taxpayer dollars to help fund you off of you not making enough, whether you decided to have a whole bunch of children, whether you're deciding not to work, whose fault is that? Yours. Not anybody else's. We're not responsible for you. We're not responsible for your junk food eating. Have healthy food, sure. It's an assistant program. You're not supposed to stay in it for the full time. I don't want to get off too far off topic though, but let me know your thoughts on this in the comment section down below. Subscribe if you like this type of content.